is National Men's Health Month, an annual observance that educates and encourages early detection and treatment of health issues among men. Can you list the 3 leading causes of death for men? Well, here with that answer and more is Vice Chair in the Department of Urology for Ochsner Health System, Eric Laborde. Eric, thanks for joining us on Great Day.
Thank you.
So let's talk about some of these health issues that affect men.
Yeah, so men, we all think we're going to live forever, but the reality is bad things do happen to us. The 3 actually most common causes of death for men are heart disease, cancer, and accidents. In fact, 1 in 9 men will actually be diagnosed with prostate cancer within their lifetime. That means that over 200,000 men this year in the United States will be diagnosed with prostate cancer.
Oh, wow.
And other things are actually very common as well, things like diabetes, heart disease, high blood pressure. So all those things can impact men.
So what are 3 simple ways men can take care of their health?
Yeah, so that's easy. Find a doctor, number 1. Find a doctor that you like and that you trust and can really talk about all aspects of your health. Number 2 is actually go see that doctor.
Right.
Just because you actually think you feel fine and feeling great doesn't mean you don't actually have something going on. And it's much easier to detect something early and prevent it than it is to actually treat it.
How often would you recommend seeing a doctor?
I'd say at least annually.
At least annually.
At least
okay.
annually. Yeah, and the last thing is don't ignore. Don't ignore things because you think they're not a big deal or think they're going to go away on their own. In fact, even simple things and common things like erectile dysfunction, which men don't like to talk about, can really be a sign of underlying disease.
Sure. So why is it that men, are they just afraid to go to the doctors, or, I mean, they can handle it themselves?
Exactly. I think men like to feel they're invincible.
Sure. Okay. So what are some key preventative screenings that are recommended for men?
Yeah, so that depends on your age, but everybody should see a doctor at least annually where you can get a blood pressure check. Other things depend on your age, like I said. Things like cholesterol and heart prevention should be checked every 5 years. Prostate cancer screening should be done at age 40 in high-risk patients. And in fact, experts are actually lowering the age for colonoscopies, your first colonoscopy, from 50 to 45 because colon cancer is increasing in younger patients.
Sure. So we're all invincible in our 20s, and then, maybe in our 30s we start to realize death is imminent.
Right.
So,
I don't know if imminent,
it happens to us all, right? It's a great equalizer, as they say. So, at what point would you recommend really going in? I mean, in your 30s, or
so I think getting a baseline. I think getting a baseline in your 30s is a great idea to find out, because you're probably unlikely to have serious disease in your 30s. But it's good to get a baseline because you might, and you want to find out if you do. But also, I would go ahead and start at least annually at 35 to 40.
I see. Okay. And then knowing about your family's history, is that important as well?
Absolutely. So I'm talking general healthy men. Family history can dictate changes in all of these recommendations because certain things are going to run in families, and you may be high risk depending on your family history.
Sure. So these are red flags, right? I mean, if you're known to have prostate cancer in your family, I mean, maybe you would want to get checked out more often than not.
That's exactly right. Say your dad died of prostate cancer at age 45. Well, wait until 40 might be a little late for you. You probably want to go a little bit earlier. So again, heart disease runs in families. So if your dad died of a heart attack at 50, you don't want to wait till you're 50 to go in to get your cholesterol checked.
Sure. And knowing, as you mentioned earlier, is half the battle, it sounds like.
Absolutely. I mean, what's the old saying, an ounce of prevention is worth a pound of cure.
All right. And so we do have an upcoming Men's Health Expo.
Absolutely. So Ochsner and the Saints are actually partnering together to team up and offer our 5th annual Men's Health Expo at the New Orleans Saints training facility. It's going to be held Saturday, June 15th from 9 a.m. to 12. Screenings are free, and all men age 40 and older are invited to participate. We'll have screenings like vision, hearing, prostate cancer, skin cancer, cholesterol, blood pressure, amongst others. Space is limited, but you can reserve your spot by calling 703-4MEN or emailing menshealth@ochsner.org.
Okay, perfect. And so 40 and up, as you mentioned, but are you doing anything to kind of take the edge off?
Take the edge off how?
I mean, maybe it's a communal event.
Yeah, the bar is not open quite yet at 9 o'clock in the morning.
Gotcha.
but no, it is a communal event. I think in the past, Sir Saint has been out there to welcome people.
So here's an incentive.
Exactly.
Right. Okay, so you can see some Saints, get checked up.
There you go. And
maybe decide if you need glasses or not, if you're reaching that age.
All on the practice field.
Okay, wonderful. Anything else you'd like to add?
No, that about covers it. Thank you.
Okay, wonderful. Thank you so much.
Absolutely.
So again, Ochsner Health System and the New Orleans Saints are teaming up for the 5th annual Men's Health Expo. It's this Saturday from 9 a.m. to noon at the Ochsner Sports Performance Center in Metairie. The Saints practice facility, that is, at 5800 Airline Drive. And for more information, call 504-703-4MEN or email menshealth@ochsner.org or ochsner.org/services/mens-health. And there's much more to come on Great Day after the break, so stick with us.